Hey everybody, welcome back to Data Says Stuff. Today I'm going to be talking about healthcare, the scariest of all topics. So please leave a like, subscribe, comment. If you have anything you want to say, I'd love to hear it. So the first thing I'm going to say is that healthcare has been broken for a really long time. The idea of patient-centered care has been gone for years now, and it's been turned into what's called a care continuum. And anybody out there who works in healthcare probably knows exactly what I'm talking about. The continuum of care is where they're looking for access points to bring patients into the healthcare system. This can be specialty clinics, mental health, can be simply primary care physicians going to the hospital once for emergency visit, anything. Once they capture your information and your data, what they do is they transfer it to their partners. And this is something that's a really common thing to happen with especially the mid-age group, the 25 to 49 age group. Their goal there is to get you into this continuum of care where you kind of go through the care system on a regular basis. You have a really specified amount of times that you have to see your physician throughout the year. You have certain criteria that your physician is trying to meet. What they're, I can't remember the exact word for them off the top of my head, but there's a lot of measurements now built in with the Affordable Care Act that really pushed a lot of this forward. It's the idea of standardizing care, taking the care that you get and making that the exact same as your neighbor and your neighbor's neighbor and down and so forth. And they stratify this out across gender and across race. They have a lot of sub criteria that is built in, and so you get those racial sensitivity classes and things like that, and it really pushes forward the idea that you're not an individual, that your care can be the exact same as the care as somebody else's care. A lot of doctors have quotas that they have to meet now. You have to see 20 patients a day, every day, or if you're in a system that uses RVUs, which it's basically a unit. It's a value unit that is built for physicians to see patients. So like a patient will come in and based on their diagnosis, they get a certain amount of units and they have to meet like a level of units per week. So if they're getting all like low level patients with, like a hangnail or something, they'll upcode those, which is making them make the appointment seem more involved so that they can get paid or so that they can meet those RVU requirements. To break this down like a lot more simply, the healthcare system is a quota system now. It's no longer based on your needs or the physician's thoughts about your needs. It's based off of a large grid style care system, which is focused entirely on specific outcomes. With the ACA or the Affordable Care Act, Obamacare, whatever you want to call it, the push forward was to make like ranges. So blood pressure is a really good example. You would have like a range of 120 over 40, or 120 to 140 over 60 to 80, somewhere in that range, I think was what was considered appropriate. And you needed to get that value into the system. So you actually would retake blood pressures frequently to try and get a value in that system so that that would be marked off of the criteria. Whereas it's not, you're no longer focused on fixing the problem. You're just focused on getting one measurement that matches the measurement that you're looking for. And this happens with a lot of diagnostic criteria now. We've pulled away from allowing the physicians to look at symptoms and the different values that they were given. Vital signs used to be a huge part of bringing a patient back and seeing if they were stable and what needed to be adjusted. Now that's completely fallen to the wayside. It's you don't actually worry so much about what the patient is there for, so much as you're worrying about what you still have to do for that patient that year. In my experience, I have been a supervisor of multiple different styles of health clinics, really low-level administrator. But what I learned while working as a low-level administrator is that we're the problem. The administrators are creating work to be done, and it's taking away from both the patient and the physician. There's no relationship there anymore, or whatever relationship is there is slowly being eroded because, you can't treat them individually. And if you do, you get in trouble. And if you look at COVID and how that's worked, that's been a great example. So I'm not giving any medical advice. I can't. I'm definitely not a doctor. But you see doctors who want to give off-label prescriptions, which is a really common thing. I had some off-label prescriptions for some things for me. I know a lot of people with off-label prescriptions. I'm not going to give any specific examples because I don't want it to turn into like medical advice of any kind, but off-label prescribing is a really common thing, and physicians do research these pills when they come out. It's not like they just go ahead and say, oh, this says treats diabetes, here you go. They look at it, they see the outcomes, they look at the studies. You see a lot of PhDs, MD PhDs, who will do things like that. They'll actually do research studies on some of these medications, and they'll find ways that they can be used off-label. And that gets shot up to the FDA, and it's a long process to get it added to the labeling, to the actual labeled uses of the drug. It takes time. So new discoveries are slowed way down because of that. And now off-label prescribing is getting people fired or canceled or just getting their reputations destroyed. And it's ruining the innovation process. It's taking all of the innovation process and putting it under this impossible standard where you can't make mistakes anymore. I know we're in a litigious culture, like people like to sue. It's just what it is. But that culture built a risk-adverse nature in health, in medicine, and the moral high ground, I guess, it's just not there anymore. There's no moral reason why you would say doctors don't prescribe off-label. I mean, there's no legal reason for it either. Obviously you're not going to have physicians being your lawmakers very often. I guess we got the Pauls, Rand Paul and Ron Paul, but very often most people making these laws don't actually understand the medications that they're working with, or the implications of changing health systems. It'd be like going into an industry that you know nothing about. So we'll say like the car industry, going into the car industry and saying cars aren't safe. We need to change airbags, but you don't know anything about airbags. So you as an administrator coming in and telling them that, airbags don't work anymore, we need to get rid of them and start over, would probably cause more harm than good. That is exactly what's happening with healthcare. And it went from being in just the clinics and the hospitals and the individual health practices to now it's going to grocery stores and to everything, theaters, car salesmen. I mean, you name it, they're involved. In San Francisco, the In-N-Out burger chain stood up to a vaccine check mandate. That's the vaccine passport idea that's been really popular in a couple of places like LA and San Francisco, New York City. That's been not very effective. I mean, the case rates are still going up, or they're not affected by that, or at least not from what I can see. But what you see is that now you've got, you want a cashier at a fast food restaurant, In-N-Out, to be checking for a medical procedure that they don't fully understand. That the patient, which now they're a patient, right? Because they're disclosing healthcare information to you. Now the patient is required to get a procedure that they don't necessarily want or need, and the physician is pulled from the discussion process. You shouldn't have to go to In-N-Out Burger to show them your papers for your vaccine. And you can't you can't remove the liability from the physician's office for this vaccination and move it to, I mean, where's the liability now? I said earlier that we're a litigious culture, but there's no litigation here. If I don't want to take the vaccine and I do take the vaccine and get a adverse reaction, who do I sue? Right? It's a government mandate, so do I sue the government? Is that even possible when you look at the time that would take and the overarching issue of like who to sue? Right? Is it federal? Is it state? Is it local? Is it county? Like who is in charge of this? I'm sure it differs in different areas, but there's no like valid reasoning behind removing the liability from the doctor's office and pushing this vaccine out into grocery stores. And across the street from where I live, there's a jockey club, and in that jockey club they give out vaccinations for free. But there was no doctor there. It was just a bunch of nurses. Fine, but they don't have a license to sue against. So who's liable if there's an issue? And things like that. It's really insane. And I think the last part I want to talk about here is the masks. It's not a healthcare decision, it's a fashion choice, right? Especially when they're cloth. When you look at surgical masks, some of them can be effective. The KN95s are great. We use those for smoke days in our area when there's fires. They really help pull out the particulates. I don't cough nearly as much. It doesn't help going out. It will filter things coming in, but you still exhale all of the same debris. You might get some droplets out of there, the spit and stuff might not get out into the world, but any aerosolized bacterium or germ factors are gonna go out just fine. So you can protect yourself that way. But so, going into these stores, it's like, it's gone from a healthcare decision, a decision on keeping public health and safety around, to a fashion requirement, like no shirt, no shoes, no service. So now it's no shirt, no shoes, no mask, no service. And that's not a good health decision, right? There are no health decisions behind that. It's based on kind of an arbitrary rule. That being said, you can't say that private businesses can't make you wear a shirt, right? So, excuse me, sorry. So you can't really, there's no real like one avenue to fight against it, to go at this and say, no, I don't really wear masks that often. When I go into stores, I won't wear them unless somebody asks me to, and in most cases they do. I'll go to the cash register or something, and that's when they tell me to put it on. But there's nobody at the door stopping you, right? So I walk throughout the entire store without a mask on, no issue. I'm sure saying this can get me in trouble somewhere, but it's one of those, I don't think there's an actual law behind it, or if there is, I haven't seen it. And, EO privileges only go so far. And you can't tell me what to do. I will listen to when you tell me what not to do. Don't murder, don't rape, don't steal, don't, whatever it is. But I'm not going to listen if you tell me I have to do something. Like take your vitamins, take this shot, wear this mask, do this thing. It's starting to move from negative rights, which is what our country's based on, into positive assertions of things. You can't come in and say what I have to do. I just don't have to listen to that. That's not how our country's founded. And it's built some of the greatest healthcare in the world that way. Deregulating physicians would allow a lot of really good physicians to make huge jumps in research, would give all sorts of different entities abilities to find and study things. We've got a lot of alternative medicines that are pretty good. You know, I'm again not a doctor, so this isn't advice, but some mushrooms are good for immunity. They build up your cytokine values that helps your immune system. There's a lot of stuff that out there that people, collagen is great. You can find natural collagen supplements, things like that. There's all sorts of just alternative medicines to boost your immunity up that would be a lot better than taking a vaccination, right? And or wearing a mask. So we're not, it's like the health value, the target that we're looking at isn't for making people healthier or keeping people safe. It's for commanding respect from the masses and requiring shows of fidelity, you know, almost like a religious practice. So that's pretty much all I have today. I am working hard on getting this channel going. So please come back tomorrow. I'm going to try and get a couple videos up tomorrow. I don't have a release schedule built out yet, and I don't really have a good video editor yet, so that'll be down the line, something to look forward to. Let me know if you have any comments in the comments below, questions, whatever. I'll do my best to answer them, and yeah, thanks. Hopefully see you soon.